Hello, my name is Laura Friedberg, and I will be presenting to the Sandia High School Health class on the topic of asthma. So here are some facts about asthma. Asthma is one of the main illnesses-related reasons that students miss school. This is why it's important for you to learn about. 24 million Americans have asthma, and 300 million people worldwide. It is the most common chronic disease globally. 10 to 12% of adults are affected by asthma, and 15% of children. So it's a very common illness, and I guarantee many of you may know someone affected by asthma. There's a good chance of it. It can be present at any age, so at adults, teenagers, and children, but it peaks at the age of 3 generally. More boys are affected by asthma than girls, and there is no cure for asthma. So what is asthma? So our lungs are made up of passages called airways that let air go in and out of our lungs. Asthma is a chronic inflammatory airway disorder, and it's caused by mucosal swelling, mucus production, and constriction of the bronchial smooth muscles. The swelling, mucus, and bronchoconstriction make it harder to breathe. In the picture, you can see what the normal airway looks like compared to one with a person with asthma. In the airway with asthma, the muscle is tightened, or what we call bronchoconstricted. It is also filled with mucus, and there is swelling. Do you think all of this would make it harder to breathe? So what are the symptoms of asthma? Wheezing, breathlessness, or dyspnea, which is when a person says they're having trouble breathing, chest tightness, and cough. The cough often happens at night or early in the mornings. So what causes or triggers asthma? Allergens such as cats, domestic pets, cockroaches, grass pollen, ragweed, tree pollen, and fungal spores. Exercise can cause it, virus infections, medications, physical factors such as cold air, laughter, hot weather, weather changes, strong smells and perfumes, food and diet such as food additives, air pollution such as smoking, occupational factors, stress, gastroesophageal reflux or GERD, and a few other factors. These stimuli trigger the airway and cause narrowing, wheezing, and dyspnea. Allergens cause an inflammatory response. Exercise causes hyperventilation and causes inflammation and bronchoconstriction. The bronchoconstriction usually ends after the exercise is finished, but can be worse in cold and dry climates. So what are some risk factors? Atopies, such as atopic diseases like allergic rhinitis or atopic dermatitis, also having a genetic predisposition, such as a family history of asthma, certain infections, poor diets that are low in vitamin C, vitamin A, magnesium, selenium, omega-3, polyunsaturated fats, a vitamin D deficiency, and even obesity. Air pollution, such as having parents that smoke around you. Allergens, such as those we talked about before, and specifically house dust mites are common. Occupational exposure, obesity, intrinsic asthma, and other factors. Just because you have these risk factors does not mean that you will get asthma. So how do we treat asthma? So common medications are bronchodilators. These are beta-2 agonists that can be short or long-acting. They provide rapid relief of symptoms by relaxing the airway smooth muscle and reversing that bronchoconstriction we were talking about. And they can also prevent part of that inflammatory response that produces that mucus. So an example of a short-acting is albuterol. This can be used as needed and before exercise to prevent an attack. A long-acting bronchodilator, such as salmeterol, is usually given twice daily and improves asthma control by reducing its attacks. Side effects include muscle tremors and palpitations. Another medication is an anticholinergic, such as ipratropium bromide. This prevents the bronchoconstriction and the mucus secretion, but is less effective than the beta agonists. Side effects include dry mouth, urinary retention, and glaucoma. Another option is theophylline. Oral bronchodilators is an oral bronchodilator that's given 1 to 2 times daily, but is not as effective. The side effects include nausea, vomiting, headache, diuresis, palpitations, cardiac arrhythmias, and epileptic seizures. Another very common medication is inhaled corticosteroids. These are the most effective treatment for controlling asthma. They reduce inflammation and attacks and can rapidly improve symptoms and improve lung function. These are generally given twice daily and usually given with a long-acting beta-2 agonist like the salmeterol that we talked about. Side effects include hoarseness and oral candiditis, which is thrush. Another option is systemic corticosteroids. These are used in acute severe asthma, which is usually a severe asthma attack where you have to go to the doctor or a hospital. It's generally given IV. So side effects include truncal obesity, bruising, osteoporosis, diabetes, hypertension, gastric ulceration, proximal myopathy, depression, and cataracts. Other treatments include anti-leukotrienes. These are given orally 1 to 2 times daily and help reduce inflammation, but are less effective than inhaled corticosteroids. So chromones or cromolone, this is effective in preventing asthma caused by triggers such as exercise or allergens, but are not meant for long-term control of asthma and have a short duration. Steroid-sparing therapies have no long-term benefit and have a high risk of side effects. Other alternative therapies include hypnosis, acupuncture, chiropractic, breathing control, yoga, and speleotherapy. These are not proven to be effective and are not recommended. I list several medications because not every medication works for everyone, and sometimes a combination medication of the medications is better. So how do we manage asthma? So first, we want to prevent attacks by taking our medication and trying to avoid the triggers. It's also important that a nurse or doctor teaches the patient how to use their inhaler properly. The patient also needs to know how to recognize if their asthma is getting worse, such as more frequent attacks or the inability to recover from attacks, and when to seek medical attention. It is very important that a doctor monitors a patient's asthma control, including how frequently are they having attacks and having to use medications to treat them. We want the patient with asthma to be able to exercise and carry on with their day-to-day activities without having asthma symptoms. The doctor may also recommend dietary changes, like eating more fruits and vegetables and getting more vitamins. If someone in the home smokes, it's also important that there's a good air filtration cleaner, like a HEPA filter, to minimize secondhand smoke exposure. The doctor may also create an action plan so the patient knows when to use what kind of medication based on symptoms and when to see a doctor. The doctor may also check the lung function using the spirometry as seen in the picture above. So what are the goals of asthma therapy? We want there to be minimal or no chronic symptoms, minimal or infrequent attacks, no emergency visits, and no limitations of activities or exercise. We want the student to be able to go to gym like everyone else and walk back and forth to class without having issues. We also want them to have little to no adverse effects from medications. So how can we prevent asthma or asthma attacks? So smoking cessation. So if you already smoke, you're already putting yourself at risk. And if you already have asthma and smoke, you're making it worse. So by quitting smoking, that's the best thing you can do. Also avoiding triggers including secondhand smoke, so if you have friends that smoke, and occupational exposure. Also limiting exposure to indoor air pollution, such as the allergens we discussed before. Making sure to always get your flu shot and pneumococcal vaccines. And making sure you have a healthy diet that includes fruits and vegetables and vitamins A, vitamin D, vitamin E, and zinc. And this concludes my presentation. Please let me know if you have any questions.